Hello everyone, my name is Vivo and I have here with me this beautiful girl.
My name is G and welcome everyone.
It's so great to see you.
I know.
I feel like it's been so long.
It's been, about over a year with COVID taking everybody's lives.
Yeah, and now that we're both are vaccinated, we can
be
be
in the
here
same room.
to deliver some good news and some bad news to you guys. So we would like to start off by saying that we would love to go back to the norm.
Right, yeah.
And with everything going on, I think we are getting there.
We are, and schools are opening up for the kids.
Yeah, and with the schools opening up, I have been seeing the rising amount of cases among children, and I think that's really bad news because that's really unfortunate. And they believe that the rising in cases is not due to the kids going back to school, but more so the extracurriculars, the family gatherings. And Arizona is actually one of the 16 states that has over 100,000 cases among children.
Right.
That's just crazy.
And the amount of cases with kids, it's 7,000 kids for every 100,000 kids that has COVID.
Yeah.
So that's a huge number.
That is a huge number, and I believe that is mostly, well, they believe, health experts believe that it is mostly due to just the extracurriculars and not so much kids being in school. And they believe that kids should stay in school and remain to wear masks and wash their hands, and that is how we can protect the children from getting this virus. And another way of protecting them is getting the vaccine.
Yeah.
And Pfizer is actually allowing kids 16 years and older to get the vaccine, and it's readily available at a lot of places.
And Arizona announced the major pharmacies will do walk-in appointments. So previously you'll have to do your appointment and wait for it, but now that you can just walk in and get your vaccine, or you can do a same-day appointment an hour before you go in. And depending on which pharmacy you go to, you can search up which vaccine they have. So the pharmacies that are included are Walmart, Sam's Club, CVS, Walgreens, and this is a great way to do it because as of late March, they're wasting about over 180,000 vaccines are being wasted. So doing walk-in will be so much better, and it will be more useful for the vaccines for anybody that wants it. But if you're trying to go to a state-run facility, you can do a walk-in and you'll get your shot. So you can do it, you can walk in or you can schedule it, and you can find the location and scheduling at potvaccine.azdhs.gov.
Yeah, and that's so unfortunate to hear so many vaccines have been wasted.
Yeah.
I know a lot of my own patients, and especially homeless patients and patients that don't have access to a phone or even a computer, have had trouble getting the vaccines, and they want the vaccines. They've come to the clinic, my clinic, asking if they could get it there, but of course we're not capable of getting it yet, but it's great to hear that these places are giving it out and allowing walk-ins so that they don't have to sign up online.
So with vaccines, because they're also with government, if you have insurance, your insurance will cover it. If you do not have insurance, it will be free to you. The government covers it for you, so you can get vaccine as you want and just have to walk in.
Yeah, and speaking of the government covering these costs, I want to bring you guys back to telemedicine or telehealth. And ever since last April of last year, Governor Ducey has implemented that these companies, insurance companies, will cover more for telemedicine visits, telehealth visits. And I think that's a great way to kind of allow low socioeconomic families as well as working mothers as well as elderly patients to gain more access to health care. And as of yesterday, he actually implemented and expanded the coverage for telemedicine, and I think it's so wonderful that he's done that.
It's a great news too, because a lot of parents in different socioclass, especially the lower class, has to do multiple jobs to support their family, and they have a very hectic schedule. They also have to take care of the kids. So having telehealth, you can schedule your own time in the comfort of your own home. You don't have to be traffic. You don't have to find a ride. You can do it through your phone, your internet. So there's multiple ways to get in contact with a healthcare provider to consult about your health. And it's a great thing, especially right now with immunocompromised patients and all this stuff going on and the hassle of it. It'll be great to do that, and I think this will be a good thing to have long term too.
I agree. And as a healthcare professional, I do see the pros and the cons to telemedicine, but of course, the pros outweigh the cons, and these patients have easily accessible healthcare is just a great way and something that I could see us progressing for a long time.
Yeah, and turning over to the other side of COVID-19 is the business side. So they have the Paycheck Protection Program for businesses out there. And unfortunately, they have run out of money. They were funded twice, and they're waiting for the lawmakers to see if they'll pass a third one. And they have given out 10.8 million loans, equivalent to $78 billion. And this is to protect the business. However, it cannot protect every businesses. So some businesses were saved, but over 400,000 businesses have closed permanently.
And I believe that the deadline isn't until May 31st.
Correct.
And it's just crazy that it's already ran out of money. Do you think that they'll have a second round or another round?
Third round,
A third round?
possibly, but we just have to wait for the news. And if they do, it'll be good news because 2.5 million restaurant jobs have been lost and affected because of the pandemic.
I agree. And if they do have another round, you can depend on us to let you know the news. I know that a lot of businesses, including my parents' businesses, depend on the PPP loan during this time. And now that it's run out, I believe that there are other alternatives that they can turn to, especially for restaurants.
Yeah, they have loans for restaurants. And the good news is it starts this Monday, I believe. It'll
Yes.
give restaurants $5 million per location, $10 million total for each applicant. And that's for business that owns less than 20 locations. And this will go to be majority for the priority will be for women, veterans, and minority groups. So for all my Asian business owners, go
Asian
out
restaurants,
there, the
Vietnamese
family
restaurants.
mom and pop shop, go for
Yes.
your grand.
I love the mom and
Apply
pop
for it.
shops.
Yeah. And to find out more information, you can go to restaurants.sba.gov.
Yeah, and I love how the first week it's open to really minority groups, right?
Yeah.
Like women who are restaurants or business owners and low socioeconomic family who has had a difficult time getting the PPP loan.
Right.
And now they have a chance to kind of be on top of the list.
And also the veterans that have fought for the country to give
Yeah.
them the thanks.
So I think go out there, sign up, and I think it's a great way.
Yeah, and Arizona right now too, to help boost the economy with all the restaurant needing employees, they have an unemployment thing that Governor Ducey has passed. So you can get up to $240 a week with unemployment benefit. However, the catch is you have to actively look for a job, and you have to show that you are actively looking for a job to qualify for the benefits. And to find all the jobs availability in Arizona, go to ktar.com/Arizona-opens-hiring to find all the positions.
Well, thank you so much for that information. And we would like to close off today. And thank you so much for watching us. And it's great to see you guys.
And keep your mask on and get vaccinated.
We'll see you next time.